Semaglutide, a medication initially developed for type 2 diabetes and obesity, has shown significant promise in treating heart failure with preserved ejection fraction, or HFpEF. This condition, which has had few therapeutic options, affects both men and women. However, recent studies reveal intriguing sex differences in the benefits of semaglutide, particularly in terms of weight loss and symptom improvement. Semaglutide is a glucagon-like peptide-1 receptor agonist, originally designed to manage type 2 diabetes and obesity. Its efficacy in reducing body weight and improving metabolic health has been well documented. Recently, researchers have turned their attention to its potential benefits for heart failure patients, specifically those with HFpEF, a condition characterized by the heart's inability to relax and fill properly. The analysis aimed to determine whether the phenotypic features and treatment effects of semaglutide vary by sex in obesity-related HFpEF. The study evaluated the influence of sex on the disease's baseline characteristics and compared the effects of semaglutide versus placebo on key trial endpoints. This was part of the STEP-HFpEF program, which included the STEP-HFpEF and STEP-HFpEF DM trials. A total of 1,145 participants with obesity-related HFpEF were evaluated over 52 weeks, with 570 of them being female. Understanding sex differences in obesity-related HFpEF is crucial. Obesity and visceral adiposity are key drivers of HFpEF development and progression. This may be even more pronounced in women, who represent the majority of people with the disease and bear a heavier burden of symptoms and physical limitations. Women with obesity-related HFpEF were found to have higher body mass indexes, BMIs, and were more symptomatic at baseline compared to men. The study revealed that semaglutide significantly improved HF-related symptoms, physical limitations, exercise function, and reduced inflammation and natriuretic peptides in both men and women. However, there were notable sex differences in weight loss. Female participants experienced greater weight loss than males, with a mean difference of -9.6% versus -7.2%. Despite these differences, the improvements in HF-related symptoms and physical limitations were consistent across both sexes, regardless of age and BMI. At baseline, females had higher left ventricular ejection fractions, presented with worse symptoms and physical limitations, and had higher levels of inflammation. They also had similar rates of hypertension and diuretic use, but less atrial fibrillation compared to males, despite their higher BMI. Researchers suggest that more female participants had a typical obesity phenotype of HFpEF, while males may have had left atrial myopathy HFpEF, complicated by an increase in BMI. Dr. Mikhail Kosiborod, a cardiologist at St. Luke's Mid-America Heart Institute, emphasized the importance of understanding these sex differences. Obesity and visceral adiposity are key drivers of HFpEF development and progression, and this may be even more amplified in women, he said. Lead author Dr. Subodh Verma added, females had more systemic inflammation and were also younger compared to previous HFpEF studies. An accompanying editorial by Dr. Anuradha Lalla highlighted the need for further studies to understand the mechanisms behind these benefits and to continue focusing on sex-specific differences in treatment responses. In summary, semaglutide offers significant benefits for both men and women with obesity-related HFpEF, though women experience greater weight loss. These findings underscore the importance of considering sex differences in treatment responses and pave the way for more personalized approaches in managing HFpEF. Further research is needed to fully understand the mechanisms behind these benefits and to optimize treatment strategies for all patients.